Everyone. Welcome to another episode of Shagalinko TV. It's a beautiful Tuesday evening, and here we are again to do the show. Today, we'll be looking at the CSO Accountability Forum that held a couple of weeks back. So, we're looking at HIV/AIDS, tuberculosis, malaria, and matters arising. And I have a guest in the house. His name is Ambassador Albano, Nnanna, Anonyuo. Okay, and together we'll be looking at all of that and looking at the vulnerable, the marginalized, the key population, the sex workers, and a whole lot. We'll also be extraying the health system in Nigeria. A lot of times when I'm in a discussion group where we talk about health issues, especially with the pandemic, and people talk about how it is so difficult to still access healthcare in Nigeria, especially for public hospitals where you get there in the morning as early as 5 a.m. You might even be number 150 or number 100, and you might just spend the whole day in the hospital just trying to see the doctor and all of that. Anyway, my guest is here and he'll be doing justice to a whole lot of these issues and many more. But let me welcome him and ask him the way we do here to introduce himself some more. Good evening, Ambassador Albano.
Yeah, good evening. Good evening, Emmanuel. How are you?
I'm fine. Good to see you again after the CSO Accountability Forum. Welcome, sir.
Good to see you too. Thank you.
Yeah, so for our new viewers, what would you like to say? I know I've done a short introduction, but tell us more about your organization, if there are projects, what you do, and then we'll take up the discussion from there.
All right. Thank you. Thank you very much, Emmanuel. My name is Ambassador Albano Nnanna Anonyuo, and I am from Ihiala in Anambra State. And this is my 21st year working in the development world, or what we call the development industry. Yeah, and in these 21 years, it's been ups and downs, but we give God all the glory that today I have a lot to talk about, and I am always disposed, to share my wealth of experience and knowledge with the upcoming ones and make sure that they are properly guided. So my organization specifically is a renewed initiative against diseases and poverty. And the acronym or the short form of it is Renegades. That is my organization. And my target population is the female sex workers, the key population, the indigent women, the vulnerable women, and all others, the youths, and others too, people who are also living with the virus. And I am also a consultant. I've worked with a lot of organizations, both local and international, on issues concerning the female sex workers and HIV/AIDS. And I have also formed networks.
Yeah.
I formed a network called Civil Society on the Health and Rights of Vulnerable Women in Nigeria, CISWIN,
Okay.
which later gave birth to the Nigerian Sex Workers Association, which is the one and only and the first of its kind in Nigeria. But my concept, and I made sure it was pushed, and today is a registered organization with the CAC in Nigeria, and a lot of foreign partners, international organizations, and local organizations too are working closely with that network. I have also gotten accolades for the work I do, most especially and close to my heart is the last one I got. That is the Heroes Award. Heroes Award I received from the US President on emergency program on AIDS relief in Africa. That is PEPFAR. So that one is the one that crowned or iced the cake of my work in the development industry. So far, that's okay for now.
Okay, thank you very much, sir. So for everyone watching us right now, if you have a question for Ambassador Albano, please drop it in the comment section, and we'll be reading them as the program progresses. If you have comments, and do also tell us where you're watching us from. It's very important for us. Tell us where you're watching us from right now. Comments, questions, opinions, just drop them in the comment section. We're looking at CSO Accountability Forum, HIV, AIDS, TB, malaria, and matters arising from the just concluded CSO Accountability Forum. I'll quickly just read a few messages here just to clear up some of them, and then we'll go on. I need you to also, in 1 or 2 minutes, do an overview of the just concluded CSO Accountability Forum. This one is from Amaka Eneme. She says, on point. And we'll have another one here. Amaka, do tell us where you're watching us from right now. And if you have questions for the prof, let us also know. This is from Irene Friday Godwin. It says, nice one, prof. And then Bethel Onyedikachi says, oh my God, I'm happy to see prof once again. Okay, so prof, your people are here and they're happy to see you. So quickly, let's do an overview of the CSO Accountability Forum. It was a huge one. I particularly liked the pre-conferences, you know, the teenage and young, adolescent and young persons pre-conference, the KP pre-conference, and then the pre-conference for women. Quickly, can you tell us, I hear this is the 7th edition and it was successful. How did it come about? How far has the journey been, sir?
Yeah, thank you, Emmanuel. First of all, let me appreciate my daughter. I'll say my daughter, or my goddaughter in the industry, that is Amaka Enemo. She's my daughter, and I'm happy she's moving on very well with all she got and all she learned from me. Okay? Hello, Emma?
Yes, go on. Go on,
yes,
I'm hearing.
Yes, so Amaka, thank you. Oyedikachi, thank you. Irene, thank you. Yeah, so the Civil Society Accountability Forum, yes, like you rightly said, is in its 7th year right now. And it goes to really mean or really confirm that the older the wine gets, the better. I remember the 1st edition, it was as if it's going to work, it's not going to work. 2nd, 3rd, 4th, 5th, 6th, and the 7th. I can tell you as a foundation member of the Peer Review Forum that the Civil Society Accountability Forum is doing excellently well. And this year's forum that was last week is not going to be an exception or the end to the progress we are making as far as that program is concerned, because we are all, we in the team, I mean, me and my colleagues in the team, we are about 7 of us or 8 of us, we are determined to make sure that this accountability forum, despite all hits from left and right, people who wanted to frustrate our efforts, to make sure that we hold organizations, partners, and everybody accountable for funds released for HIV and AIDS programming and funds released for TB, HIV, TB, malaria too. Sometimes it doesn't work very well, it doesn't go down well with some people, but we are more than determined to push this accountability into everybody's system. And I thank God we are succeeding. We try. In as much as some organizations are still working against the peer review forum, some are trying to do everything to frustrate the efforts we are putting in, but we're not going to relent. We remain undaunted and we're going to push it to the end. So like I rightly said, the peer review forum came in about 8 years ago, and gradually we kept talking, and it is composed or comprised of people from different backgrounds. We have Professor Morenike, who is a specialist, and academia too. We have Ize Adava, we have Olaide Akoni, we have Obadako, Obatunde Oladako. I have my comrade, Umoru Ibrahim. I have Walter, I have Maureen Onya, and my humble self, the man that talks sex work and sex workers all the time. And I no apologies. So it's me for the key populations, and here I am with you. We've come a long way, and we are not giving up.
Yeah, thank you so much. So in case you're just watching us, this is the Tuesday's edition of Shagalinku TV. My name is Ambassador Emmanuel Gabari. Shagalinku TV comes your way every Tuesdays and Saturdays, 9 p.m. on the dot. Please share the video, share the link right now so that others can be part of the show. The comment sessions are there. You are free to drop your comment. And also do let us know where you're watching from. And if you have questions for Ambassador Albano, do drop them as well, and he'll be responding to them. I'll be asking him a few more questions, especially on the fight against HIV/AIDS, TB, malaria, and all of that as we go on in the program. But still drop your comments, and then we'll read some of them. Okay, Ambassador, I'd like you to read some of these comments here. This one is from Patience Alfred. If you see it on the screen, please do read.
Yeah, she's watching from Adamawa State, yeah.
And then Eke Joba Fine or Fine.
Yeah, Eke Joba Fine, that's great. She's privileged to be here and a member of the Nigeria Sex Workers Association. Thank you, Eke Joba, I like that, thank you.
Okay, so I'll go on now and ask you the next question that I have. I'm also going to ask you why the need for sex workers, key population, and others need to access healthcare in Nigeria. But first of all, can you take a minute or two and examine the health system and health issues in Nigeria? Even with the pandemic, it's still difficult for people to access healthcare. I said in my opening that a lot of people have also complained, especially peasant women, you know, they sometimes might need to travel 1 hour, 2 hours from their destination to come to a primary health care center. And then when they get there, the queue is forever. And then by the time they see doctor, they are so tired and they need to go back. How is the healthcare system in Nigeria?
Thank you, Emmanuel. I will take it in a nutshell before I expatiate. The healthcare system in Nigeria is nothing to write home about. I'm not singling out any particular area of the healthcare system. All they have nothing to write home about. And it keeps getting worse by the days instead of getting better. It's very unfortunate because this is like a persistent issue, it's a persistent problem. And all the efforts that have been put to ensure that the health system works and works very well, I think it's been thwarted by the high and mighty who can also afford to junket around the world or around the globe to get what they feel is a superior health attention from other parts of the world. While the one right there at the back of their houses is not functioning. So I think it's like the not well-to-do should better dig their grave and count their days, while the well-to-do can pick up a private ambulance, a private jet ambulance, and get out of the country to get 2 weeks, 3 weeks, sometimes 1 month, and rush in 2 months of medical attention in places where people developed like the ones in Nigeria that we can develop. The healthcare system, like I say summarily, is nothing to write home about. And the worst of it is that even the people who work in these facilities that we call our healthcare facilities are not helping matters too. Some are trained, some are not trained. Some are ill-trained, but some are trained but being driven by selfish and monetary, undertones. You go to a hospital, the welcome is 0, the waiting time is forever. You see a pregnant woman, somebody at the point of death or delivery or that needs an emergency, and you see nurses on their table there, they sit down gisting as if nothing is happening. You go and call a nurse to come and attend to somebody on emergency, it will take her forever to come, something that would have ordinarily taken some seconds. But the lackadaisical attitude and, I don't care, attitude is dealing with us. So people will die for negligence on the part or from the part of the health workers. And some of the doctors too, some are not properly trained. The ones that are trained, sometimes they are in the hospital, most times they are not in the facilities. Most especially when we talk about public health facilities. And you can imagine what we get when they are not in the facilities and the hall is filled up with patients who want to access Medicare or healthcare attention, and they have nobody there to attend to them. Most times they prefer to come, give you, or what do they call it? They will direct you to a private facility, and by the time you get there, you see the same doctor you are seeing in the same government facility. You see him seated right there at his own private hospital. So they divert people from the public health to their private clinics, thereby frustrating the government and whatever they have, the little they have in the public health systems. Okay? And then drug stockout is like an old story. You can never go to any, in fact, even to get Panadol from a public health facility is like putting the elephant through the eye of the needle. So I think for Nigeria, it is really a very serious thing. And we talk about the stigmatizing and discriminatory attitude of the people you call people who should provide you with health care services. They don't want to touch you because you are living with HIV. They don't want to touch you because you say you're a sex worker. They don't want to touch you because you say you are a man who has sex with a man. They don't want to touch you because you say you are a transgender. They don't want to hear that. You see, sometimes we put this religion and moral thing right there before giving people life-saving services. It's very unfortunate. And I think we have to talk about training and retraining of these our health workers to bring them up to speed with the global trends. In Nigeria, we are lagging behind, and unless something drastic is done about it, then we keep dropping from where we are now until we drop to a level where our hospitals will turn to mortuaries. All the hospitals, public hospitals especially, will turn to mortuaries, because if they can't attend to people who are coming to access healthcare, you can't attend to them. Some of them die right there in their presence due to wasting of time. Somebody who would have ordinarily saved by injecting or giving some pills or something, we don't care, and the person dies off, and they feel they're better off. They're better off, and it's very unfortunate. So we have a long way to go in putting our health care system in order and to ensure that it gives the services it's supposed to. The drugs are there, the people who work there are trained and retrained, and they get people who are really qualified to work in those places and not just pick anyone because you know someone that knows someone that knows someone, and they bring you there to just kill people, and then how do we move on from there? So for now, let me rest it there until we get to somewhere we'll talk about it again.
Thank you so much, Ambassador Albano. In case you just joined us, we're just like 21 minutes gone into the show. I'm having my guest, Ambassador Albano, Nnanna, Anonyuo, and we're looking at the CSO Accountability Forum that just rolled by, and we're also looking at matters arising. I'll be asking you a very pertinent question. A couple of years back, commercial sex workers were raided, and it's still been going on. I know a lot of organizations protested, held placards, and talked about the human rights of these commercial sex workers being violated and all of that. And aside that, we've also heard and seen a lot of times where commercial sex workers are raided, and then they are also asked for sex in exchange for bails or release and all of that. We'll be talking we'll be looking at all of that shortly, but I'd like us to quickly read a few more messages because there are so many of them here. And this one is from Ojuma Stephanie. It says, hello, everyone. I'm Stephanie Okoriko, NSWA Program Officer. And this one is from Ibrahim Hassan. It says, well done, Prof. Another one here is from Patrick Eneyo. It says, watching from Akwa Ibom State. I'm the National Secretary of the Nigerian Network of People Who Use Drugs, and I'm also a member of the National CAP Secretariat. Samuel Shama says, well done, Oga Emi Gabari, and also my Oga at the top, Prof. Ekejuiba says, watching from Rivers. I'll take one more, and then Ambassador, you will answer the other question on commercial sex workers. This one is from Aisha Asel. It says, well done, Prof. My name is Aisha Umar. I'm working from Kano State.
Hi, Aisha. I remember Aisha very well. Hi. Oh, yeah. So,
yeah, so go on, sir.
Okay, you talked about police harassment.
Yes, for sex workers and all of that.
Not only police, even the civil defense. And but first of all, let me correct. Yeah, there was a wrong use. There was something you mentioned that isn't correct. You used commercial sex workers. Please, there is nothing like commercial sex workers, please.
Yeah, it's sex workers actually. Sorry, my wrong. Yeah.
We have female sex workers. We have
male and female sex workers. Yeah.
Nothing like commercial sex workers. And again, point of correction.
Yeah, apologies.
Before we get deep into this, who is actually a sex worker? Yeah, who answered the question? Who is actually a sex worker? Is it the one that stays in a hotel and collects money from someone who comes to have sex and pay? Is it the one that works in a big office who joins the Oga or the whoever for promotion? Is it the one, I mean, sex work, in the real sense, the definition is exchange of sex for material and other benefits. So sex work happens everywhere. In the offices, in the homes, in the market, everywhere, name it, sex work happens. But if you go by the definition, exchange of sex for material or other benefits, promotion, handset, travel ticket, what do you call it? And other things you can just think of. So the idea of police, you saw someone on the street or wherever hanging out, waiting for somebody to pick her up and you raid. That is a total violation of the person's right. It's been long. We've been fighting. I myself, Amaka, who is the national coordinator of NSWA, understand what I'm talking about. Sometimes we go out late in the night into the streets of Abuja to check out, to know if there are harassments or arrests. Sometimes we go to police station. Sometimes they go to court to go and stand for members of this NSWA. And now, what we are talking about is a violation of an international treaty, the one that is called CEDAW, C-E-D-A-W, Convention on the Elimination of All Forms of Discrimination Against Women. That is CEDAW. It was signed in 1979. Yes, 1979, am I correct? 1979? 1979, yes, it was signed 1979 and adopted in 1979, but became effective in 1981. And Nigeria is also a signatory to that particular document that was made and adopted by the United Nations General Assembly. And it is supposed to be addressing or eliminating all forms of discrimination against women, all forms of discrimination against women. And the International Bill of Rights for Women, effective from that 3rd of September 1981, it is actually the first critical step in developing a standard for basic human rights for women to address actions and violations such as physical, sex, economic, and political, and to promote women's equality of rights and well-being. But what is going on in Nigeria today is directly an opposite. And the funny thing is that most times these people that come out to raid don't have the official permission of their superiors to come out. But I'm sure the KP Secretariat have, in conjunction with some partners, international partners and local partners, have organized series of outreaches or trainings for the law enforcement agencies, and advocacies have also been paid, been made to them to educate them on this particular violation of rights of sex workers. But the funny thing is that these guys feel it's a way for them to make some quick money. They come out, they pack as many people they find on the street as possible. Some of them, of the sex workers, have been raped. Some have their handsets stolen. Some have their, personal earrings, jewelries, and things stolen by these law enforcement officers. It's really a shame. It's really a shame, but we keep pushing. It's still work in progress. But I hope they'll remember this CEDAW, Convention on the Elimination of All Forms of Violence Against Women, that it is an international, a global treaty that was signed in 1979 and put to work in 1983. And Nigeria is a signatory. So these things keep happening, but it is not going to stop us. We, the advocates, we, the activists, it will not stop us from pushing harder to ensure that someday it will be Uhuru for the sex workers in Nigeria and for the key population and for the ones, the downtrodden, and for the ones who are being harassed by these law enforcement agents, because it's a total violation of their rights. Okay? Thank you.
Yeah. Thank you so much, sir. In case you just joined us, this is the Tuesday's edition of Shagalinku TV, and my name is Ambassador Emmanuel Gabari. Shagalinku comes your way every Tuesdays and Saturday night, 9 p.m. Okay, I have some messages here. Keep your messages coming, and do remember to also share the link to this live video so that others can join. If you have questions for Ambassador Albano, he's here, just drop them on the comment section. It will pop up on the screen, and then we'll read it out. I'll take a few, and then Ambassador, you'll also read some of them and then give response. This is from Love Lane Nwabridge. It says, I'm glad to be here. Stephanie Okoriko says, Stephanie Okoriko watching from Abuja. Another one from Lovely Nwabridge says, watching from Ibadan, member of the Nigerian Sex Workers Association, also a member of the key population in Nigeria, Emanuela Lovely Nwabridge. This one here is from Pamela Maria Benjamin. It says, watching from Benue State, a member of the Nigerian Sex Workers Association. And this other message here is for you, Prof. It's a question, actually. I'd like you, if you see it on the screen, please do read and respond. It's from Akufei Valentine Jonah. Please read, sir.
Okay. Yeah, Jonah, how are you? Yeah. If I think that implementing partners are transparent, it's like, yeah, okay, I get the question. Yeah, I get it. Yes, okay. I get it.
So would you like to respond? Please do respond to it as we move on.
Yeah, straight up. I think, Jonah, you are 100% correct. And that has been one of the things I personally have been challenging and fighting. The implementing partners, honestly, are not transparent in most times in selecting partners that implement HIV, TB, and malaria programs in Nigeria. Because if we do, or if they do, by now we should not be talking about singing this song we are singing today. What is the HIV prevalence rate in Nigeria today? Have we gone up or are we coming down? Have we been able to do a very sincere IBBSS, that is integrated biobehavioral surveillance survey, to actually find out what's going on out there in the rurals and in all the places. But we are still in a situation in Nigeria where partners choose what I call sometimes briefcase NGOs, or what you may call leeching organizations. Organizations who have a two-story office, they have the biggest signpost in Nigeria, but in terms of technicalities and the implementing know-how, or the technical know-how to implement, to be able to interpret what is in the document and what is in the field. I mean, it's not there. But because they are big organizations, they have big signboards, they have big project vehicles, they are giving projects that at the end of the day doesn't touch on the people who those projects are meant for. It's very unfortunate, and it is still happening. It is still happening, but I know that with time and with the pressure, both from the KP Secretariat, they have done wonderfully well. My own NSWA, from my daughter Amaka too, and the team members, they have done a lot of work trying to say, we are here. Nothing about us without us. You cannot take what belongs to me. You cannot shave my hair in my absence. I need to be on the table. I need to be part of this discussion from the beginning to the end. I need to be part of the implementation. I need to be part of the evaluation. Yes, because if they are not part of all these, people will go out there, come back and do very mighty reports back to the donors. But those reports, I can tell you, are not real, because next tomorrow, same projects from another organization will come up and same state and location will be picked again. And then it's a vicious circle. It's a vicious circle that we keep running around this vicious circle and we don't hit anything because of the way and methodology that implementers are selected. We talk about supervisory roles in the field. Who does that? I mean, it's a whole lot. It's a whole lot. It's a whole lot. But with time, we get there. With time, we get there. Okay? With time, we get there. It's a work in progress, yeah.
Yeah, let me take another message here, Ambassador. It's from Irene Friday Godwin. It says, we understand that funding HIV implementation has moved from engaging sex workers-led organizations to sex workers-friendly organizations. And the strategy used by most of the implementers are not catchy, as we all know that certain activities were introduced in the past that improved uptake of services. How do we address these gaps? It is not just about HIV. We also have other health needs, and we want to be responsible for our community members. What do you have to say? This is from Irene Friday Godwin. Over to you, sir.
Yeah. Hi, Irene. I think Irene was at the Accountability Forum. I think she was the one that presented on behalf of her national coordinator, and I had a chat with her. Irene, I may not be in a very good position to conclude why the shift. I'm not sure it's a total shift from engaging sex workers-led organizations to implement for themselves to sex workers-friendly organizations. I don't think it's a total shift, but I think from my own personal perspective, I think if an assessment was done, and maybe the sex workers-led organizations are not yet matured, are not yet, quote me, are not yet matured enough technically, to implement their project. I think there may not be anything wrong in picking a sex worker-friendly. I am not a sex worker, but I have been the godfather of sex workers in Nigeria. But I have been championing. I traveled to a lot of countries where I was invited to speak for the sex workers. But at the time, I told myself, no, I am not a sex worker. I think it's time I engage. I bring in the sex workers to come and do the representation. Unlike some people who want to be junketing, traveling from here to there, globetrotting and all that. But I gave it up. And I'm happy today that it's not a wrong decision I took. So we can also believe that not all sex workers-led organizations are technically sound to implement for themselves. So there's nothing wrong in using sex workers-friendly identified friendly organizations who will definitely need to engage sex workers to be part of the implementation of the project on behalf of the organizations. So I don't think it's bad, but we keep pushing with the partners, because the partners and the funders sometimes are the problem. They stay out there in their countries and they design projects that will happen in this country. And when they throw it in, we embrace it without challenging them. And then you see things that are not realistic, that are not our own people friendly in the documents, and you expect us to implement it hook, line, and sinker. It doesn't work like that. It doesn't work like that. I think it's time we own whatever we do in this country. It's time we reject impositions of proposals, of concepts that are not people friendly in this country. Just because they are bringing the money, they want to tell us how to utilize the money, whether it's going to work for us or it's not going to work for us. I mean, it's very unfortunate.
They don't care.
But we keep pushing. The Cabinet Secretary should be pushing, NACA should be pushing, all the local agencies should be pushing. Let's shout ourselves for us while screaming on top of our heads that this has to change. We need to domesticate the concept and the proposals that are being funded by these international donors and funders, not imposing what they think it is on us, and we go out there with it. Sometimes we come back without results. So it's okay, work in progress, we keep moving. Thank you.
Okay, sir. So if you're still watching us and you have questions for Ambassador Albano, please do drop it and we'll be reading all of them. So many questions and comments here. We'll take as many as we can. And this one is from Okwifu. It says, great job, sir. Emmanuel Chubuzo signing in. A second time around, it says, higher man, salute. From Faith Imaluobe, it says, great job, my prof. There's a question here from Bethel Onyedikachi. If you can see it, please do read and then respond, sir.
Yeah.
Can you see it, sir? It says CSO Accountability Forum has, it's just a comment, has been an interesting one, experience being shared, lessons being learned, and having to sit and listen to partners in Nigeria who work tirelessly to end HIV pandemic in Nigeria. Okay, thank you so much, Bethel. There's another one I was trying to get. I don't know if we've read this one from Irene. I think that was the question you answered before.
That's the one I spoke to. That's the one I just addressed right now.
Okay. So there's another one here from Ezewani Ojiugo. It says, well done, Ambassador Albano. You are doing a great job by creating this awareness. More grace to your elbow. Kudos, more grace. Thank you so much, Ezewani. There's another one here from Malik Haruna. It says, good evening, all. Let me read it. Let me pop it on the screen. It says, good evening, all. I'm happy to be part of this enlightening program. Malik Haruna, a member of CAP Secretariat, Kano. And then Anthony Enemona Amedu. It says, I'm watching from Abuja live. Thank you, boss, at Ambassador Albano. Akufo, I think we've answered this one, Prof. He was asking if you think that implementing. Yes, we've answered that. Okay, so let me leave these ones now and still come back to you and ask a few more questions. I'd like us to also talk about drug users, because sometimes in implementation, drug users, key population are also people who can't access regular healthcare centers. What are the gaps and why do you think that I'm really happy you also mentioned it when you started off, that a lot of healthcare workers need to be trained and retrained, because people shy away from going to regular hospitals for want of for fear of stigmatization and a whole lot of others. I'd like you to talk about these two issues together as we also go on, because time is really running out. I think we might do a part 2 anyway. Please go on, sir.
Okay. Yeah, you talked about people who inject drugs or people who use drugs. They are two different. Well, sometimes we mistake them for the same. But from my own little knowledge, people who use drugs can also be people who smoke Indian hemp, people who use umurumiri, the current trend in the southeast, people who use codeine, people who sniff, what do you call it, solution and things. Yeah, there are people who use drugs. But when you talk about people who inject, or we call them injecting drug users, IDUs, they are a different category of people. And why they were actually singled out is that they are at more risk of contracting HIV or any infectious disease, because what they do is intravenous drug injection. So that group, the Nigerian network, somebody, I think Nnanna, is it Nnanna or somebody? Yeah, they are doing a very good, yeah, I think Nigerian network of something like that. They are doing, yeah, I don't know, Nimpud or something like that. They are doing a good job. I know Anonyuo, who is also a member of the KP Secretariat. He is doing wonderfully well in that area. Okay, so the injecting drug users are always a very important group to target. One is not only about that they are injecting drugs, but also that they stand a chance of getting infected with the virus and go ahead to infect other people. So but sometimes due to our moral beliefs and everything, somebody's injecting drugs, we should leave him to die, he doesn't deserve any mercy and that. But who knows? It may be that girl who ingests drugs, maybe your son, she will meet in a club or somewhere and they get going. And if there's anything like infection from here, it goes to that side. That boy may be the one that will pick your daughter out there. I mean, it can be either of the ways. So we need to pay great attention to people who inject drugs or injecting drug users. I also talked about the transgenders. You understand, but it's a trend that people need to come to terms with. I also talked about the men who have sex with men, the MSM. They are everywhere. We can't deny it. In the church, in everywhere. They are in the National Assembly, in the presidency, they're everywhere. So why are we playing an ostrich? Okay, why are we pretending that this does not happen and they happen? I mean, the earlier we come to terms with realities, confronting us and facing us and harassing us, and then sit back and face a drawing board to really work out a way that we address the issues those things are throwing at us. Until then, it is not going to be huru. And the numbers keep increasing by the days. I mean, there's no two ways about that. So let's get it straight and let it get right into our skulls. Most especially the ones that sit there to make policies, both friendly and unfriendly ones, the ones that sit there to give orders, both friendly and unfriendly ones, the ones that sit there and tell you they are monitoring what you're doing when they are not really monitoring anything. All the conferences, all the meetings, all the seminars, all of them, we keep coming back with different names for the same thing. We do this one this year, we call it MPPI. Next time we come back with another name for the same thing, the same content. Who is fooling who? I think it's time, and our evaluation system is nothing to write home about. Because if you don't evaluate a project, how do you know if that project has really impacted on the people you want it to impact on? How do you know if that project has succeeded? And it is even not good to use the same people who implemented the project to evaluate the project. It's good to bring in independent monitors or independent consultants to go and evaluate based on the concept or the proposal that was being funded. They go internalize it, bring out their questionnaires and everything. They go into the field and do the evaluation of project and give you a very clear and concise report from the field. Not doctored, not biased, not anything. Even the people who implemented will not even know who did the evaluation. I think that's a way to go. And that's one thing I think we keep pushing. I will start pushing for that. Independent evaluation of exited or finished or closed projects so that we can bring out the truth in it and throw it back at the people that funded. Okay?
Okay. Okay. Ambassador, we really need to wrap up now. Time is really not on our side. I really didn't know we'll have so many messages to grapple with, but it's a promise that we'll do a part 2 of this and bring you back to, because there are so many questions I really need to ask, but let me quickly just read some of these messages here, and then I'll come back and then ask you to wrap up in 1 minute. This is from Princess Ekpenyong. It says, good evening all. I'm Princess Ekpenyong, Executive Director for Initiative for Young Women's Health and Development, Cross River State, Calabar, Nigeria. So happy to be here. Another one here is from, well, so many of them. Ifoma Obaemeka says, good job, Ambassador. Dr. Leroy Frazier from the United States of America says, I like this open and helpful information. Thank you so much, Dr. Leroy. It's good to know that you're watching us from the US. Thank you so very much. So many messages here. I'll just read 1 or 2 more, and then I'll give the floor to Ambassador Albano to wrap up. This one says, it's the legend. It says, watching from Ifite, Oka, and then Charity Obeka Albano says, Charity watching from Ifite, Oka. Well done, sir.
That's my wife. That's my wife.
Oh, that's good. Thank you for supporting our guest. We really appreciate. I'll take 1 more. So many messages here. This is from Emmanuel. It says, good evening all. I am Emmanuel Nnanna. I work for the LGBTIQ community. It's good to be here, and it's also good to know that we are all working up to this important conversation. Thank you, Nnanna. Peter Nweke says, good job, Prof. Watching from Calabar. One last one. One last one here is from Akufai. She says, he or she, sorry, they say, thank you, Prof, for the response. What do you think about the over-monetization of the HIV response in Nigeria, especially the end users of HIV, sexual reproductive health and rights, products and services? Could you quickly answer this, Prof, as we wrap up? From
okay, first of all, please, I can't. First of all, I appreciate my wife. I appreciate my sister-in-law, Ify. I appreciate Raspi. I appreciate everybody. And coming to Jonah Akufai's question. Well, it's been a trend. It's been a trend. What do I think about the monetization of the? It's a trend. And that's exactly what we're talking about. And when you talk about monetization of HIV response in Nigeria, it doesn't even trickle down. It's a trend that has to be contested, that has to be, we need to do everything to get that corrected. I mean, if it's about service that oriented HIV work or something, then it's something we would have been seeing the results. But some of us now are in this industry because of there's so much money from different donors. That's coming from this Grand Global Fund, PEPFAR, all of them are throwing in money from left, right, and center. And I think it's gotten us a little bit away from what actually we should be looking at. And not only that we're monetizing these things, but unfortunately, you'll be surprised that, for example, 100 million is budgeted for a project. Oh, Chukwu Mayike, my Oga at the top, thank you, sir. You'll be surprised that 100 million is budgeted for a project. My brother, Nigerians, hear me. 100 million naira is budgeted for a project. 90 million naira from that 100 million will go to overhead costs. Buying vehicles, renting big offices, paying out of the world salaries. And then, even the people who are going to implement, the civil societies, are going to get peanuts. The big organizations will pay their workers 1 million naira, 800,000 naira a month, while the civil society personnel who will be in the field to do this work will be paid 20,000 naira in a month. While the colleague who is sitting in his confined, a very comfortable air-conditioned office, driving in a chauffeur-driven official vehicle, is getting 1 million naira every month. And they expect you to do this job and give them the report that they are going to feed back to the international donor agencies. You are the one who will do the work, but you are not going to get nothing. You will not be remunerated properly according to the services you are rendering to ensure that this project is well implemented and successful. But the ones out there, I said 90 million will go to overhead costs, 10 million will go to the field work. How will it succeed? How will it yield the dividend? We still do it. We suffer, but we do it just because it's our country and we need to get these things done, not because we're having the best of times working with this, but especially these international organizations that are situated in this country. I don't want to mention names now, but some of them that have their offices here in this country, I can tell you, let's keep this for another day so that we don't remove some of these cards out. I have a lot of them. Maybe on a new day, we can talk about that.
Yeah.
But I'm really not
so
happy.
finally, what would be your last word?
Emma, I'm not happy the way the civil society players in this country are being treated by some of these funders. I'm telling you honestly, slaves we are. We are still being, some of us, in fact, most of us in the civil society space are being treated like slaves. First of all, they design their concept, they design their proposal, they do the budgeting and send to you. If you don't like it, then you are out of it. They look for the next organization who will be able to grab it and implement. Sometimes you are forced to procure some of the commodities you will need to implement the project. You are forced to procure them from a particular country. You are forced to procure your logistics, your vehicles from a particular country. Or you cannot use our money to buy this country's brand of vehicle. It has to be our own brand of vehicle. So is that not round tripping? You give me money, 100 million, and I'll put back 90 million procuring from your country. Not minding the cost of courier, the cost of shipping, the cost of air freighting, and the cost of the landing costs to my country. No, but those same things are here. Why can't we get them here? But they want the money, the dollars they are giving you to go back to their country. And they will be screaming. They have funded Nigeria to the tune of $300 trillion. While in the real sense, that 3/4 of the money went back to the country that sent it. And then the remaining 1/4, anyhow, it is being managed here. But the civil societies, at the end of the day, they bear the brunt of everything. They are always on the wrong side as far as our funding partners are there. Emma, let's leave all these discussions. Wow. If you want to talk with Prof, it's going to take us a while.
We will bring you back for a part 2 where we will do all of this. But finally, what in 1 minute, what's your last word of advice to everyone? And as we wrap up, yeah.
I don't know if I have the opportunity of appreciating some people that, or am I going to do something like that after this?
Please do. Yeah, you can appreciate now and then you wrap up. Yeah, please.
Okay, Amaka Nemo, Adiolu, I see you. Chuku Mari Kechokzi, I appreciate you. Raspi, yeah man. Chibuzo Emmanuel, Lovely Nwabrije, Irene, oh my goodness. A whole lot of the Jonah Kufai, Ifoma, Obemeka, Obu, and all of them. I really appreciate all of you, and the ones I can't even remember. Michael Amalumilo, one love, brother man. Yes, so what is there is honestly, we need to really get back to the drawing board. We need to confront these funders But the funny thing is that the high and mighty, the people up there, when you talk about accountability, which is part of what we are doing at the Civil Society Academy, is to bring these partners to the table. Tell us what you have done for us. How much did you bring in? What did you do? What did you achieve with it? But most times they shy away. If we tell you the number of partners, funders we invite to that forum, we invited to the forum, but they will promise you will be there, but at the end of the day, they will not come. Because it is called Accountability Forum. Come and tell us what you brought to the table. Come and tell us what happened to what you brought. Where did it go to? Who took it? What came out from it? Accountability is not there. And that is the problem we keep. And then, like my friend Jonah asked, selection of implementing organizations should not be a man, no man thing. Select people based on their technical prowess. Select people based on their record. Select people based on their antecedents. Select people based on facts and figures, not based on man, no man. By the time we start doing that, putting the right round peg in the round hole, I think we keep running round and round and round this vicious circle. I think a lot needs to be done. And Naka, let me just leave Naka out of this for now, maybe for another day, because their matter and different matter. But people, yeah, I'm sure you'll be hearing of cap. I don't know if you understand what it means. Cap. You heard that it came up severally. CAP is key affected populations. And CAP is comprised of the sex workers, the transgenders, the men who have sex with men, the injecting drug users, and which other group am I leaving out? No, I think these 4 groups. And they are at the center, when you talk about center of this HIV work we are doing. But sometimes you find them being treated like rags, like trash, because you feel, because you have the right, you are seated there in your office, you can decide what happens to them, you can do anything you want to do with them, and you push them out, you muzzle them down. You are not doing it to them, you are doing it to Nigerians. Like my friend Aisha from Kano, if Aisha doesn't have the level of capacity she has today, that was built by the NSWA, courtesy of my goddaughter Amaka. If Aisha doesn't have the capacity, she can't implement in Kano. But today she has all the capacity, at least she needs to talk to the sex workers in Kano. So we should allow the key affected populations to drive some of these projects that affect them, so that we can get the desired results. Unless, well, to God be the glory. Yeah.
Wow. Thank you so much, sir, for that very wonderful one. And thanks to everyone who joined us. I really didn't know we'll have so many messages. But it's a promise. I'll talk with Prof, and then we'll find another time to bring Prof here. You know, Prof is always a very busy person, but we'll find time to also bring him here. We're reviewing the CSO Accountability Forum that just rolled by a couple of weeks back and or a couple of days back, and we just decided to do a part 2 of this. So we'll still be bringing Prof and maybe 1 or 2 more people to also talk about it. But quickly, let me read a few messages in the next 1 minute, and then I'll wrap up. Michael Amalumilo says, bravo Gambari and Prof, following up. Chukuma Anyaike says, very good initiative, and a whole lot more. This one is from Victor Alban. He says, well-spoken Pops. Thank you so much for that. And to everyone who joined us. We really must thank everyone for finding time to join us. Let's do it again on Saturday, God willing, 9 p.m. My name is Ambassador Emmanuel Gabari. And remember to like our pages. It is Shagalinko TV. like our pages on all our social media handles. We're streaming live in 3 destinations right now, on Shagalinko TV Facebook page, on Shagalinko TV YouTube page, and also on my personal page, Ambassador Emmanuel Gabari. The videos will still be here after the show. Keep the conversations going. Drop your comments on the comment section. Ambassador will still be looking at it from even after the show. So we'll be creating response and all of that, so that when we bring him in the next part 2, he'll be able to also collect some of these questions or comments you have, and then respond to all of them. Let me thank everyone who joined us from across the world. God bless you all. We really don't take it for granted. And let me thank my guest again, Ambassador Albano, for finding time to be here in spite of your very, very busy timings and all of that. We truly, truly appreciate you, sir. I hope when we fix the next one, you'll join. Anyways, my name is Ambassador Emmanuel Gabari, urging you to have a beautiful Tuesday evening. Stay blessed, stay safe, and remember to touch a life. Some messages dropped by. Let me quickly read them. Kasimia Nwankwo says, Francis watching from Anambra State. Nesto Izwogu says, I missed the live, but I'll be following. I know Ambassador Albano and what he represents. Yeah, you didn't miss anything. The video is still here. You can watch it on YouTube and watch it on Facebook, even after the show. So it's still here. There's nothing you missed. Francis watching from Anambra. I think we read this before. I really hate to go, but I have to go, or else we'll be yanked off air from this right now. So thank you guys for being there for us. God bless you all and have a sweet Tuesday night, right? Bye-bye.